Tape it and make it. Hello everyone. In this video, we will show you a special taping technique for respiratory problems, for problems related to colds, allergies, or any other respiratory disorder. For this, we have two areas that we tape. One area on the face, in the area of the frontal sinuses and nose, and another area on the back. For the taping technique on the face, we have prepared 5 small strips about 2 inches long, 1 block wide. My colleague will now show you the exact taping technique. First, we divide the backing paper and put the first strip just below the eye, without pulling. Do the same with the second strip on the other side. And the third strip we tape above the eyebrows, also without pulling again. The same with the fourth strip. It is important to emphasize again that the face should not be covered with face creams or similar products. The fifth strip is divided in the middle and applied with a light pull in the area of the nose root. Then rub all strips again and change to the taping technique on the back. Now we come to the back area of this taping technique. We have already prepared 3 strips for this. We measured 2 strips of classic tape from the 7th cervical vertebra downwards. This is on the left and right side. In addition, a slightly shorter strip of tape is applied in this area. These taping techniques are based on the findings of traditional Chinese medicine. So we will work here along the meridians and tape a special regulation point here. The upper strip is applied approximately along the upper edge of the shoulder blade. My colleague will present this area to you. We have our patient bent forward. Bend his head forward to get into a pre-stretch. Now, we loosen the base of the tape. Tape it at the level of the 7th cervical vertebra and place the tape completely without pulling about 2 finger widths next to the spine. Now we rub the tape on. The same on the other side. We remove the backing paper from the base again, stick it on, remove the rest of the backing paper and tape it without any pull, 1 inch to the left of the spine. Now we rub the whole thing again. Then we divide the next tape in the middle, apply a light pull on it, and tape approximately along the upper edge of the shoulder blade. Now rub it on again. Then we let our patient stand upright. This completes the taping technique for the respiratory tract. Thank you for using Kintex. Tape it and make it.